Okay, so now it is time to discontinue your IV. Perhaps it is not functioning anymore. Perhaps, hopefully, your patient is being discharged home because they're all better. Yay! So, supplies we need. We need several alcohol swabs. I usually just grab,
Handfuls.
a handful, 4, 6, 8, whatever. Several pieces of gauze, Band-Aid, and tape. And there's a reason for that, which I will get to shortly. So what you want to do, first of all, make this clamped off, show everybody's comfortable, okay? So you're actually going to open several of your alcohol swabs. And if you're talented, you can get multiple.
You do all of them like that at once?
I do sometimes. Yes, I do. It saves time.
It does.
It saves time. So, and you'll see some people open them one at a time and use them one at a time. Some people, like me, I'll grab the entire handful. So what we want to do, what this does is this will kind of help remove the adhesive just until you kind of get a spot up. And especially for your older people who may be really prone to skin tears, this is of vital importance. So basically what I'm doing, I am very gently pulling up on the dressing and wiping the adhesive while pulling very slowly, okay?
It releases the adhesive without pulling my skin.
Correct. All right. Then we are going to, I'm actually going to start on the other corner. That hopefully will come up here in a minute. There it goes. I'll start on the other corner. Sometimes it goes quickly, sometimes it does not. It depends on what kind of adhesive was used to place the line. Okay, you'll notice what I'm trying to do is actually pull up on all 4 corners.
Without dislodging the catheter.
Without dislodging.
Until you're ready.
Okay. Sometimes this process takes a while. If your patient is having a lot of pain, if they look like their skin is very fragile,
Take the time you need.
Take the time you need. Do not be in a hurry on this. I would rather take a few seconds. My patient won't have a skin tear. And be in a hurry. So now you see that I have it bunched up. I literally just have it bunched up right here. So that basically I can do this with one hand if necessary, okay? All right, and then I will take a few pieces of my gauze. So, all right. Ooh, I missed a piece. All right. Make sure all your adhesive is up.
Remember, there's tape underneath there, too.
Yes.
So you
Make
had
sure
to
you
do
get
it to
the
the tape, too.
Yes.
Because that was the anchor.
And what you'll do, and then this just needs to just come right on out, okay? It's just one swift motion.
Ready? Okay.
And immediately have your gauze ready to go. Resist the urge to immediately rip the gauze off to check for bleeding because you may just rip the clot right off.
You need pressure first.
Pressure first. At least 15 to 20 seconds for a small line. If you have somebody who perhaps has a bleeding condition, you could be sitting here for a couple of minutes. Do not be in a hurry. Sometimes what I will do is move my fingers. I won't release pressure. Move my fingers to see if it is bleeding through. If it is, you grab more gauze, you place it on there. Okay?
Also, I released my fist because remember the fist held all the blood in the vein when we were trying to expose the vein to access it. So releasing the pressure by opening my hand, there's less pressure on the vein, therefore more likely to clot, which is what we want, that spot to clot off and not bleed.
Yeah. Okay. So then I look, it's been about 20 seconds at this point. And so then I look, I don't see it bleeding through. I can take it off. The site looks good. I don't see any really much oozing. You might see a tiny bit.
That's okay.
So I am personal with when I'm removing an IV. I am personal to using gauze and tape. Because it can handle a little bit more blood. You will see some people use Band-Aids.
Doesn't really put enough pressure on that area, especially if they're on blood thinners or anything like that. Gauze and tape will less likely have a difficult outcome because this applies pressure of the gauze onto the site directly, whereas the Band-Aid doesn't have much pressure.
Yes. Now, if after a couple of minutes your patient decides that a Band-Aid is what they would rather have on there, then that's fine. But like I said, I personally will create a pressure dressing to ensure that this site heals appropriately. So, okay. And that is how you discontinue an IV.